Hey, Dr. Shakib here from Core Pelvic Floor Therapy in Irvine. We're going to talk about pelvic floor dysfunction symptoms, so stay tuned. All right, let's talk about pelvic floor dysfunction symptoms. A lot of people think pelvic floor dysfunction means incontinence. Not necessarily always. There's so many other subtle symptoms that may exist, or symptoms that are not so subtle, you just don't relate them to your pelvic floor and its dysfunction. For instance, you can have incontinence, you can have lower back pain, you can have lower sacroiliac, this joint right here in the pelvis, sacroiliac joint dysfunction. You can have issues in this area, which is the lower part of your mid-back and the lower back, that junction, and impact the pelvic floor, leading to dysfunction. You can have constipation. You can have hip issues. You can have a lot of bulging tummy. You may think, okay, well, maybe I was pregnant and I have a little bit of a baby tummy, or maybe you're just sitting for an extended length of time and you have pelvic floor dysfunction. I want you to stop thinking about pain as a sign of pelvic floor dysfunction and more look at mobility in this area and its impact on pelvic floor dysfunction. This is why so many people could catch their problem way before it becomes significantly worse, where at times the only way is to address the issue surgically speaking. If you look at this part of your body as a paper bag, the bottom of the bag is your pelvic floor. Pelvic floor is not just floating there, it's connected to different parts of your body. Any dysfunction or lack of proper function in those areas will lead to pelvic floor dysfunction. So this bag, the front of it is your abdominals, going all the way to the pubic bone area. The sides are the side portions of your abdominal muscles, and the side portions of the back portion of your body. The back part of the bag is this back area. The very top is your abdominal diaphragm. So imagine that bag with the top being abdominal diaphragm and the bottom being pelvic diaphragm. So when any portion of this bag is less than optimally functioning, it has its role and impact on the floor of the bag. So for you to do nothing about it because you don't have pain is just a recipe for disaster. Because by the time you have pain and any function related to the pelvic floor that comes with pain, a lot of damage or issues are there. You need to understand the contents of the bag are your prostate if you're a male, uterus, ovaries, lower intestine, actually intestine, and also bladder. So if the contents, just what is supposed to sit in this bag in a bowl at the bottom is, if the bottom is not strong enough, all of those being there have their own toll. Just the weight of them can be kind of taxing on the pelvic floor. So pelvic floor dysfunction does not always come with pain. It's a dysfunction. It comes with the lack of proper function. So keep that in mind and understand that it can manifest itself in many ways. Thank you for listening and watching this video related to pelvic floor dysfunction. There are a lot more videos that are related to the subject. Make sure you subscribe to the channel And if you have any questions, contact me. Until next time, take care.